This is our first trainee pharmacist open house. We're really excited to have you all here, and we're really keen to tell you about the opportunities within Epsom and St Helier pharmacy teams. So we've got a number of our colleagues who will be on the call periodically to talk about their experiences and give you some really good insight into what life is like within our pharmacy team here. We're also going to tell you about a really exciting opportunity that we've got for what we're calling the talent pool. So this is a means for you to have your clearances done, be waiting and ready to be appointed to vacancies as they become available. So it's something we've not done before. And as I said, we're really excited about how that will work. So Patricia is going to talk a little bit about that in just a while. So sit tight. We'll have time for questions and answers at the end, but if there's anything burning that you want to ask us, feel free to just put your hand up and do that as we have each of our guest speakers along. I think that's it from me. I'll hand over to Patricia to talk a little bit about, well, to introduce herself first, actually, and talk about the talent pool model.
Thank you very much. So thank you for joining us today or for watching the recording afterwards. So I will introduce myself first. My name's Patricia and I am the Deputy Chief Pharmacist for Transformation at Epsom and St Helier. So a little bit about my role first because it helps us get to why we're here talking about talent pools today. So my role is to lead improvements across the department that have an impact for us, but also outside the department across the organisation, but even wider, so that patients can feel the impact of our services, and we can see the impact that we're having in our local community. So when you're thinking about what services should a pharmacy department deliver, especially in a time of change and flux in the NHS, you have to think about the people you have within your team to deliver your aims and objectives. So we have been thinking a lot about the type of team we want to be and the type of people we want to join our team. And we have decided that we're going to put a lot of effort into recruiting the right people at the beginning of their career, and then putting time and effort into supporting them and nurturing them so that hopefully their career can progress with us. And you very much will have a career opportunity with us at Epsom St Helier. And that's why we've come up with the idea of talent pools specifically for trainee pharmacists. So we want to get to know you right at the point where you're ready to come work as a pharmacist. We want you to get to know us as an organisation, and we want you to get to know specifically our department and the people in it, because we think once you've met the team and heard a bit more about our offer and the opportunities, if you sit back and reflect about what you've heard and decided, you know what, that's a team that I want to join, then brilliant. We would be delighted to see you apply to join our talent pool afterwards. So this is what this is all about. We really are aiming to be a kind of cohesive team. And today you will meet a variety of people from our department as well. And then a little bit about the talent pool, because I imagine there will be questions at the end. So as I'm sure you're aware, if you follow NHS jobs, trusts put out band 6 pharmacist positions constantly. And that's because naturally band 6s become band 7s and they move around. So there are a lot of vacancies. But that means that every time a trust is going through a recruitment process, it, I guess, work for the trust, but it means every time they're encountering a new set of people, and the people who are applying don't really know the organizations, because until you kind of get through the door, you don't really know what's on offer for you. So we're proposing one formal recruitment process. So you will apply as you would normally. There will be an interview day, but provided you meet the minimum requirements to be offered a post, you will then enter a talent pool, and you will sit there until we think March 3, so quite a long time actually. And as posts naturally come up, we will slot you in rank order. And through that time, you'll have further communications from us. You'll have opportunity to come and meet us. So we continue to try that aspiration of getting to know each other. And hopefully the idea of the talent pool is it's a lot more streamlined, so that when vacancies do come up, we've already done your checks and you are ready to join us. So after today, we're going to open up a live vacancy for the band 6 rotational pharmacist role at the organisation, and that will remain open until Sunday, the 4th of June. That will be your deadline for applying. In the quite quickly afterwards, we will be shortlisting to make sure that everyone who has applied meets the criteria set out in the specification, so standard kind of NHS application process and checks. And then you will be invited for interview, hopefully quite quickly. And our interviews are taking place on Tuesday, the 13th of June. Exact details of where to show up will be provided when you get the invite. And again, as it's we are planning to move quite efficiently through all the steps, so we hope by the end of that, if not the beginning of the next week, to let everyone know whether they've been successful in entering the talent pool. If you're in the talent pool, we are offering the opportunity to come meet us and some of the team face to face on the 12th of July. And what that will look like, we'll engage with those in the talent pool to see what they would like to see, and then we'll build the in-person kind of insight around what you're asking for. As you might get, we're a team, we like to listen, we like ideas. So if you're asking to join the team, tell me what you'd like to see and we'll try and make it happen. Bit more of an insight into day to day. Then I guess you'll all be very aware you will have be doing your registration exam and waiting your results, which will come out 27th. Is it? Am I remembering the date correctly?
Yeah. It's close to my birthday, I remember.
Yeah. So once you get your results, if you get the result you want, and we all hope you get, then you know that you're going to be a pharmacist, and that is when we will be able to give more detail on who will be slotting in which time frames. Currently, we will be looking to slot some people in quite quickly after registration, and we are holding vacancies specifically for you as trainee pharmacists. And then after that, we will continue to filter through as the year progresses. So I hope that's a brief introduction of why we want you to consider us, and why we're very excited about trying something different. And I'm very excited for you to meet the team because I think they're great. So I'm going to pass on to Jo.
So hi, my name's Jo. I'm the Principal Pharmacist for Education and Training. So I've just got a quick presentation that I'm just going to share with you all. Perfect, great. So as I already said, so my role is education and training. So I've just got a quick agenda for today. So I just wanted to give you all an overview of my role and what I do on a daily basis, how we offer band 6 to 7 progression, the support that we actually have available for band 6 pharmacists, and why I'd recommend joining us at Epsom and St Helier. So in terms of my role, so day to day I'm managing the trainee pharmacists and coordinating their training programs. I'm also working alongside their pre-reg pharmacy technicians and supporting their development through monitoring and supporting the operational delivery of their programs. I'm monitoring the education and training of all pharmacy staff. So in particular with band 6 pharmacists, you will be on different rotations and you will have different objectives that you need to meet, and you may be starting the diploma at some point. So you will need support from an educational supervisor and support from myself to guide you through that program. And then essentially I'll be sort of an oversight looking at education and training across the whole of pharmacy, so all of your statutory and mandatory training as well. So with regards to when you actually start at Epsom St Helier as a band 6, what we're trying to introduce at the moment is a band 6 to 7 progression pathway, so that it's quite clear from day one how you can develop your career with us. So as you start as a band 6 pharmacist, we have rotations across both sites, which are usually 3 months in duration, and you'll cover a range of specialities. So this could be from surgery, respiratory, cardiovascular. And so it really gives you a chance to really develop your clinical knowledge and build on from your training year. It's also an opportunity for you to start the first line on call. So during that time, it will be you as a individual pharmacists who will be on call for a particular site, so rather Epsom or St Helier. And it will also be a really good learning opportunity for you, because it sort of puts you in a sort of independent environment to answer queries and deal with different members of the MD team. And that's how you'll sort of develop yourself as a pharmacist. During each of the rotations that you have, you actually have a set of rotational objectives which you will need to meet. And that just helps us to ensure that you are getting the right knowledge and the right understanding from all of your rotations. So these objectives are actually presets, and you will have a rotational lead who will go through this with you at the beginning of each rotation, just to see where your competencies are, what you might be lacking, and where you need further support. During each rotation, you'll have a meeting at the beginning, a progress review mid-rotation, and another meeting at the end, just to make sure that we can sign you off on all of those objectives. And if you have any issues, then it would be your rotational lead that would guide you through those. So as part of the progression from band 6 to 7, you will be starting a clinical diploma in pharmacy practice, which we do through UCL. So this is split into two, so FS1 and FS2. So I won't go into too much detail about them, but FS1 is sort of an 18-month postgraduate certificate. So during FS1, you learn a lot of clinical knowledge and a lot of work-based place activities like mini-kexes, CBDs and DOPs, which you probably have done in your training year. And then FS2, depending on the route that you go down, is rather 18 months where you cover audits or service improvement projects, or we have another option of doing your independent prescribing course. So it is part of the progression pathway that you are at least doing FS1. So again, we do encourage all band 6 pharmacists to progress and develop their clinical knowledge by going on the diploma. So another part of the actual part of the pathway is progress reviews. So in order for us to ensure that you're meeting all your competencies as a band 6, you will be assigned a educational supervisor from day one of starting with us. So that person will go through a plan with you from the beginning about what we would expect from you during your band 6 rotations, and what workplace-based activities that you need to be competent in order to be able to progress to band 7. So you'll have regular meetings with your educational supervisor who will go through all of that with you. Once you meet all of these competencies, you meet your objectives and you're on the diploma, then eventually, once we have a vacancy, you will be eligible for a role as a band 7 pharmacist. So this time frame obviously all depends on where you lie with your objectives and your competencies and how far you are into the diploma. So as an actual band 6 pharmacist, with regards to support that you'll be getting, so you'll be linked with a band 7 buddy. So this will be your go-to person for day-to-day questions about the operational activities that we have in the trust, or if you have perhaps a clinical question and your educational supervisor isn't on site to ask, then your buddy will be your go-to person. You'll have meetings with your rotational leads, as I've discussed, at the beginning, midway, and at the end of each rotation to ensure that you're progressing through all of your objectives. And again, you can raise any issues you have at any point. We also have lunchtime teaching sessions, which all of the band 6 pharmacists are involved in. And it's a chance for you to share what you're learning on each of your rotations. And it's quite good if you're on another rotation and you just you're not sure what to expect in your next rotation and you go to a lunchtime teaching session. It can offer quite good clinical knowledge with regards to a case study from that particular rotation and how that band 6 pharmacist has dealt with that case, what resources they've used and what resources that you might use on that rotation as well. And then lastly, we also have the progress reviews with your educational supervisor, as I've already mentioned. So lastly, why would I recommend that you join us? So firstly, it's just the amazing team that we have here. So both at Epsom and at St Helier, we have very close-knit teams who are really supportive of staff. And if you're struggling or need support or just need that buddy or go-to person, you will find that person in our team. And I think because we're all close-knit, a lot of people really enjoy actually working here. And secondly, it's the clear progression pathways which we're trying to facilitate at the moment. So as I've shown you, it is going to be quite structured with regards to how you can progress from band 6 to 7. And we will ensure that we do support you through that pathway and give you the guidance and any advice that you do need. So yes, that brings me to the end of the presentation. Thank you.
It's a really comprehensive programme, actually, isn't it? So it's good to see that there's so much thought and care taken into making people feel supported, and looking at having something really robust in place for development. Because I think you need that in the early stages of your career, don't you? It's really valuable.
Definitely. I think as a band 6 pharmacist, it can be quite daunting,
Mm.
with all the expectations on you. So we're trying to offer as much support so you don't feel sort of left alone. Or so yeah, if there's no questions, then our next presenter is Helier. So he is our principal pharmacist for Swelliok. And yes, he'll be telling us a little bit about his role.
Hello, good morning, everyone. Thank you, Joe, for your presentation before. Yes, I'll just introduce myself again. I'm Helier. I'm the senior pharmacist for the elective orthopedic centre at Epsom and St Helier. Just a little bit about the centre itself. We conduct most of the, if not all of the major operations for elective hip and knee replacements for 3 of the hospitals around us, including Croydon, Kingston, and St George's, as well as the local population that we serve directly for Epsom and St Helier as well. So over the next couple of weeks, we will hopefully get an accreditation to become a surgical hub as well, which will be along the national directives of creating these specialist centres across the country, where we're sort of helping to tackle routine operations that are required for quite a large cohort of patients in order to get essentially their mobility back and to relieve pain and give them life-changing surgery. We're also a centre for excellence and have been for a long time, which is something that I can be very proud of to be part of later on in the journey, but my colleagues before me have all supported that journey, and it's something that we look to sort of maintain moving forward as well. With regards to pharmacy, we're quite special in the fact that when the centre was designed and set up originally about 20 years ago or so, it was designed with the image of having ward-based pharmacists in the centre and working closely with the nursing and the medical team, and the surgical team as well, right from the very beginning. And as a consequence of that, the service has matured and developed in quite significant ways, often implementing newer strategies that have come along, like independent prescribing, for example. Some of our nurse prescribers or pharmacist prescribers were the first in the country to take on those qualifications when it was introduced a good number of years ago now, long before my time in any case. So we've always been leading with regards to sort of implementing these new strategies and services, and also the individual qualifications that you can get into the service, and seeing how that we can deliver the best care for our patients. With regards to pharmacy at the moment, the current projects that we're working on are essentially related to the pressures that we will see within the NHS at the moment, and that's with regards to really, really high waiting lists essentially, and people waiting a very, very long time to get either their minor surgery or get long-term surgery. This has impacted as a consequence of not only the demand on services and the lack of surgeons, because it does take a long time to become an orthopedic surgeon, but also the fact that COVID has impacted us as well over recent years as well, with people having their procedures delayed, or often diagnoses not happening at earlier stages to lead them to surgery at a quicker rate. Subsequently, the pharmacy team, as well as the surgical team and the medical team, are working on ways to optimize patient care through hospital. And one of our main strategies is to implement a day 0 pathway, where we're sort of getting people home on the day that they have these major operations, whether it's a knee replacement, a hip replacement, or a shoulder replacement, which is really, really sort of cutting edge at the moment in terms of being able to recover patients quickly, but also to be able to look after them when they get home. So a lot of it is to do with the medications that we give with regards to pain relief medications, controlling post-operative sickness, nausea, and vomiting, and also looking at what other drug history medications the patient came in on, and when they can be optimized or restarted during the perioperative and post-operative phase of their care. It's really a progressive centre with their own research and development department, which sort of builds into our pathway, including new things that we're looking at in terms of clinical trials and medical implants that can go in directly into the knee joint that can help prevent pain without needing to use opiates. So there are lots of projects that we're working on moving forward, and pharmacy plays an integral role in all of this, because of course we're dealing with medicines, and pharmacists are the medical specialists when it comes to knowing about the characteristics of medications, or whether it's supporting clinical trials like the ones that we hope to do in the future. It's a very exciting time because the number of patients that we need to treat is large, but also that means that we need to come up with innovative and creative ways of dealing with the issues that we have and working with the teams in order to do that. And I think I'll echo what Joe said. One of the greatest things about working for Epsom and St Helier is the close-knit team, and also your integration with other teams that you work with in the clinical environment. So you're very much working with pharmacists in your team, and also with the clinicians, the nursing staff, and the wider team as well. So that's porters, could be involving getting medicines from one place to another, or it could be with the theatre staff as well, with regards to my position. A little bit about my team, just before I finish off. My team consists of myself as the Band 8 specialist lead. Then I usually have a rotational Band 7 and a rotational Band 6, and we have a fixed Band 5 technician as well. And we're all ward-based. We spend the majority of our day in a structured way participating in consultant-led ward rounds, providing pharmaceutical interventions at the point of prescribing, which has always been a gold standard, or that we've been trying to reach in other areas where throughout the country people want to make sure that the initial prescription is right. Subsequently, you're not sort of chasing prescriptions and trying to get things changed or amended. And it means that it's better patient care ultimately at the end, if they're getting the right medication at the right time, at the right dose, and it's all been screened at that point. We then screen TTOs and drug charts afterwards, and then we facilitate discharges. So obviously, with a centre being as big as ours, we have a very, very high turnover and quick turnover of staff. Not staff, of patients, and subsequently we need to facilitate those prescriptions as well. So we would be in the process of leading on pharmacist-generated TTOs, so generated by pharmacists, and also supporting that with the anaesthetists that write the prescriptions for patients as well, and just making sure that the patients are in the best possible position, both in terms of having the medication supplied, but also the information surrounding their medication and follow-up about their medication in place by the time they are discharged, usually on the same day of surgery, which again is a monumental effort from all of our team, including the dispensary team, that facilitate the dispensing of those medications, but it allows us to deal with the incredible demand that's on the system. And actually, these joint replacements change people's lives. So if we can get the operations done, and more of them done for more people, we're changing more lives on a daily basis. And I think ultimately that's what we're all that's what we're all working towards. And if you come to work for us, hopefully you can be a small part of that, just like I and my colleagues are as well. Thank you very much.
And next we have two rotational Band 6 pharmacists, Natasha and Kashifa, who will just be sharing with us their life as a Band 6 pharmacist and the transition from their training year. Hi, Cash.
Hello. Yeah, hi. I've got Natasha here as well.
Hello.
Yeah.
Okay.
So we are both newly qualified Band 6 pharmacists working at Epsom and St Helier, and we were the previous cohort of TPs from last year. So as trainee pharmacists at this trust, we carried out various rotations such as women's and children, renal, cancer services, intensive care, medicines information, and many others. And these were these helped us to prepare for our GPHC exam and also life as a qualified pharmacist. Some of the roles in the trust that as pre-reg comprised of carrying out medicines reconciliations on the ward, making pharmaceutical interventions, screening TTOs and drug charts alongside the pharmacist, as well as learning how to manage the inpatient and outpatient dispensary.
Yeah, so as qualified pharmacists today, we've actually currently undergone quite a variety of rotations within just under a year. So I myself, if I went through the rotations that I've completed so far, I've completed my stroke/outpatient rotation. I've done women's and children's health, and I'm currently undertaking my gastroenterology/outpatient rotation at the moment.
Yeah. And I have completed 3 rotations as well. So my first rotation was respiratory at Epsom Hospital, and my second rotation was general medicine at St Helier, and currently I am now in my elective orthopedic care rotation. So I'm just going to speak a bit about my current rotation. So normally, as part of my rotation, the first thing that we do is the pharmacist actually accompanies the on-call consultant and the nurse in charge on ward rounds in the morning, and I'm able to see how the patients are doing post their surgery. Normally, it's hips and knee replacements that we do. So I see that, and I am able to make pharmacological interventions with the consultant on the ward whilst I'm there. And due to actually working quite closely with experienced consultants, I've actually learned quite a lot about post-surgical care and drug treatment plans for patients. During my rotation as well, I think one of the highlights of my rotation was that I actually was able to also go into theatre and witness a knee replacement as well, surgery, as part of one of the rotational objectives of my rotation. And I was able to have a lot of training on the rotation by my lead, Zahir, who actually spoke earlier on as well as going and speaking to the physios because they're a part of the care. And I also had lead nurses actually giving me training as well on what they do post-surgery as well. So it was a very valuable rotation that I'm currently in.
Yeah. So if we talk about one of the key reasons why both of us chose to stay at Epsom and St Helier Hospital, it was due to particularly the staff who continuously supported us throughout our time as trainees, and that was still maintained as qualified pharmacists. So this literally ranging from the pharmacist to the techs, literally everyone had something to offer. So obviously, as you can expect, pharmacy, it can be quite overwhelming at times, but having that strong support system with your colleagues, it can make the experience worthwhile and just better overall. Also, there are regular training sessions that are provided to us by a variety of our colleagues in order to aid our learning, which is quite beneficial for our progression. Throughout our specific rotations, we are also assigned a lead and as well as a buddy who oversee our progress and development. And throughout it, they provide us with valuable feedback in order to progress as well and develop. Another thing, so equality and diversity, they are 2 key aspects which are promoted in our pharmacy team. So we strive to give equal opportunities to members of staff. The team, they work closely together to identify gaps in development and provide them with the necessary support to progress, which is one of the key things in our place. In our experience, we are able to approach senior members of staff for any clinical or personal support that we may require.
Yeah, so we hope you gain some insight into our trust based on our experience working here, and we hope to welcome you in the near future as qualified pharmacists.
Thank you very much.
Great, thank you both. That was really good to hear, especially because you've been here as trainee pharmacists, so you've experienced that transition and how difficult and challenging it may be. So I'm really glad that you got the support that you needed. So thank you.
Thank you. Thank you very much.
So that actually brings us to the end of our presentations from our various staff members. So now the floor is open for any questions that anyone does have.
I should say, if people, don't want to speak up now, we're very willing to take questions offline, and we can circulate the contact details of myself and Joe. We're very happy to do that.
And I think that's probably the easiest way. And then people can watch on replay. We can add contact details to that when we send that link out as well, so people have got a direct connection to you. But that was a really good session. And for our first one, I think that was pretty good. We'll send the link out, as Patricia mentioned earlier, for the talent pool. That will go live today. So we'll send the link out to everyone that signed up for this webinar so that they can apply. And obviously that will go out on Track and NHS Jobs as well. So you can apply via that means too. Thanks, everyone. Great. Bye.